Good afternoon, everyone. This is Dr. Val Arkush, Chair of the Montgomery County Board of Commissioners. Today is Wednesday, October the 7th, 2020, week 31 of the COVID-19 pandemic here in Montgomery County, and our 15th week in the green phase. Today, I'm joined by my colleague, Commissioner Ken Lawrence, and Solicitor Josh Stein. Since the October 6th press release, we have had 47 new cases of COVID-19 reported in Montgomery County, which brings us to a total of 12,318. These positive cases are a result of a positive test for the virus, not from an antibody test. All 47 of these cases are from the community. 46 of the 47 tests are from the last 7 days, and one test is 8 days old. These positive individuals are from 24 municipalities. All 62 Montgomery County municipalities are home to individuals with COVID-19. Today's individuals range in age from 12 years old to 87 years old. As always, you can check our county map found at montcopa.org/COVID-19 for the updated geographic information. Today, we have 21 females and 26 males. I am pleased to confirm that no additional Montgomery County resident has lost their life to COVID-19, which keeps us at 836 deaths confirmed positive from COVID-19. Today, our hospital numbers are a bit increased. We have 37 individuals that are hospitalized in a Montgomery County hospital with COVID-19. That is an increase of 10 compared with last week. And 10 individuals are requiring a ventilator, or approximately 27%. Earlier today, I was notified that one inmate at the Montgomery County Correctional Facility has tested positive for COVID-19. This individual was committed to the correctional facility on October the 1st and has been in a restricted housing unit since commitment as part of the facility's routine intake process during COVID-19. All other individuals in this housing unit are being retested for COVID-19. This individual is stable and in isolation. This individual is not in today's official count due to the timing of the notification. I'm pleased to continue to announce that testing is going smoothly in our 8th week with Mako Medical. With very rare exceptions, the county's results are available within the contractually promised 36 hours and sometimes even more quickly than that. Do want to remind people who are being tested that at the testing site, you will be given information on how to register to get a text or an email from Mako as soon as your test result is ready. I encourage you to sign up for that notification. That is the fastest way to get your result as soon as it's available. Our testing capacity remains at 50 tests per site per day, which is 300 tests per day across our county sites. We continue to have good availability of testing, so I urge anybody who wants or needs to be tested to get tested. The more we test our community, the more that we know what's going on in the community. And so it's fine to get tested whether you have symptoms or not. This is one of our best tools for our county to be able to suppress an outbreak if we see one starting to erupt. I do want to announce that Monday, October the 12th, is a federal holiday, and the county's testing sites will be closed. So they will be closed Monday, October the 12th. As a quick reminder, we have 6 sites. You do not need a car in order to visit them. The sites provide testing at no cost, though we will bill insurance if you have it. They do not require a healthcare provider's order, and we will test individuals of any age. We are happy to test children. I know that's been a problem for some people. We are happy to test children, even infants. All appointments are made the day of testing, starting at 8:30 in the morning. You cannot book ahead. All we do ask is that anyone being tested be a resident of the county or work or go to school in the county. Our sites are in Pottstown, Lansdale, Willow Grove, Green Lane, Ardmore, and Norristown. To register for a test, you can go online at montcopa.org COVID-19 and click on the green County Testing Information button at the top of the page. You can also register by phone. That phone number is 610-970-2937. And just a reminder, both the website and the phone open at 8:30 in the morning for appointments. If you go online at 8:29, it's going to say that it's closed. So just reload the page at 8:30 and you'll be able to make appointments. So as we continue to work together and diligently follow the mitigation guidelines, we continue to suppress the viral spread here in Montgomery County. And we continue to see stabilization in our numbers, which is great news, but we still have plenty of virus circulating in our communities. So let's go to our weekly graphs. We'll start with our date of test graph. And as a reminder, these are our number of tests that were done. Number of positive tests that were done. Those are the gray bars, the vertical gray bars, and you can see the dates beneath them. And then all these lines have kind of mushed together. So you know what, Todd, why don't we go ahead and go to the zoom in one? I think it'll be a lot easier to read. So just as a reminder, the pink line is the total 14-day average, and that is for all sites. The lighter blue line is the 14-day average from cases in the community. So that excludes long-term care facilities, the correctional facilities, places like that. And then the darker red line is the total 7-day average, and the darker blue line is the community 7-day average. So you can see we're doing okay. Our 14-day average is a little lower than our 7-day average. You know, we are starting to see a few more cases out there, you know, slowly ticking up. Nothing too substantial, but again, there's still plenty of virus out there. In terms of who's testing positive, we've got an update for you on our age cohorts chart today. And you can see by looking at that we are seeing more virus in younger age groups. Particularly, we've seen increases compared to last month in that 34 years and younger age groups. So this represents several different things. It represents colleges to some extent, although very little here in Montgomery County. In more cases, it represents students going back through K through 12 schools, particularly students involved on sports teams. So, you know, we do still continue to see plenty of virus out there. So please, please be careful. Our overall positivity continues to look very, very positive. We are actually down a little bit more this week at 2.24%. Last week, we were at 2.36%. This week, we are at 2.24%. So that remains great news. I'm also happy to let you know, and this is part of why the positivity has gone down, we tested almost 1,000 more people in the past week than we did the week prior. So that's great. That means that we are doing a lot of surveillance testing, which is what I'd love to see because it gives us a real window on what's going on all across our community and gives us a really excellent chance at suppressing any outbreak that might be starting to bubble up. Just to give you a sense, in this past week, this is actually data through October the 2nd, we tested 25,349 people in that week ending October the 2nd. In the prior week that it ended on September the 25th, we tested 24,373 people. So it's great to see those numbers going up. Again, the more information we have, the safer that we can help keep this whole community. And today I want to share with you something that was in the Philadelphia Inquirer this morning, and I want to give a credit to John Dushnesky at the Philadelphia Inquirer who compiled this data. And I wanted to put this up because it shows that while we are stable here in Montgomery County, and that's what that light green color that we are at indicates, that we are either at stable or decreasing rates of cases, all around us are counties that are slowly rising. And we are certainly seeing in other states, nearby states like New York, to some extent New Jersey, cases are slowly rising. So I just want to sound this cautionary note. I think that, we've had a lot of good news out of the county thanks to your hard work and your diligence in following these guidelines. Our positivity is low, the lowest it's been in this pandemic. But that doesn't mean that we get to relax and take off our masks and start, having bigger social gatherings. Our numbers are low because the people in the community have been following this guidance and doing their best to keep themselves and their families and their neighbors safe. So just another way of reminding you there is still a lot of virus circulating out there, and we must continue to be vigilant. So I have to run through my list one more time. I know you're sick of hearing it, but do not leave home without a mask. And please put it on whenever you're within 6 feet of someone who is not in your household, and that includes outside. If you are at a sporting event, watching one of your kids play a sport, please have a mask on at that sporting event. You're probably standing up and cheering for your child. And whenever anyone is yelling like that, if you happen to be carrying virus, you will be exhaling an awful lot of it. So just please keep that mask on. Keep 6 feet of distance from anyone not in your household. Keep your hands clean and away from your face. Please get tested if you need to or you want to. And if you do get called by the contact tracers, please cooperate. I do want to give a quick update on the COVID Alert PA app. Just as a reminder, this is a free mobile app that helps notify and give public health guidance to anyone who may have been in close contact with another person who also has the app and later test positive for COVID-19. The app uses Bluetooth only. It does not use any type of GPS or anything that actually locates you. It works without revealing the user's identity or location. The app is designed to let you know if you've been exposed to COVID-19. And the way that's defined is that you were within 6 feet for longer than 15 minutes. You were that close for that long to an individual who was confirmed to have COVID-19. You will not be told who or where you were exposed, but you will be alerted that you have been exposed and to seek medical care. Now, new this week, the app is now in use in New Jersey, New York, and Delaware. So that means that if you travel to any of those states for any reason and you get exposed there, the app will work and the app will notify you, even once you're back here in Pennsylvania, that you've been exposed to someone who's been confirmed positive for COVID-19. And that way you can get yourself tested and speak to your doctor and get good advice. I really want to urge business owners, especially those whose employees interact with the public, to consider having all of your employees use this app. It's a great way to keep your employees as well as your business as safe as possible. So the more people that have this app, the better it works. And certainly businesses that have public-facing, public interacting employees, I would really strongly encourage you, for the safety of your employees, to ask them to download this app. Okay, moving on to a couple of announcements. I want to announce the Montco Cares program, which is now open for applications. This is for Montgomery County child care facilities that have suffered disruption due to low enrollment, and it's for parents struggling to pay for child care due to the loss of income from the COVID-19 pandemic. And this program is designed to provide you with financial help. The commissioners have allocated $12 million of federal CARES Act money to fund a new grant program to assist both facilities and families. The program is called Montco Cares. The program will be administered by the Early Learning Resource Center, Region 17, in conjunction with the Montgomery County Department of Health and Human Services. And it's important to note there's two different components to this grant program. First, I'm going to talk about the component that is for child care providers. So we have grants for child care providers. They can support Montgomery County child care centers that are experiencing reduced enrollment due to the COVID-19 pandemic. Grant applications are open now and will close on November the 2nd. In order to apply, you have to be a child care facility licensed by the Pennsylvania Department of Human Services that has been open before March 1st, 2020 here in the county. You need to have experienced disruption due to COVID-19, have a license capacity of no more than 600 children, and you cannot have already received a Monco Strong Small Business Grant or a Monco Strong Nonprofit Resiliency and Restoration Grant. We do need a certificate of compliance from the Pennsylvania Department of Human Services that shows that you're in good standing. Additional requirements and applications and all other information can be found at montcopa.org/Montco Cares Program. That's Montco Cares Program. And the maximum award for a facility can be as high as $48,600. It depends on your size. Now, for families, the Montco Cares Program will provide Montgomery County families with financial support to help pay for child care for children enrolled in a Pennsylvania Department of Human Services licensed child care facility. Now, here's the big thing. This will cover the cost of child care for children between the ages of 6 weeks and up to 13 years old. So you can apply for, and if granted, use these dollars to help pay for child care of a school-aged child while you are at work. So we've gotten the ability to apply these funds to school-aged children. Grant funds can be used for child care costs beginning October the 5th and through December the 30th. But these dollars can only be used this year in 2020. They must be spent by December the 30th. The grant applications are open right now, and they will also close on November the 2nd. To qualify, eligible families must have a gross median income of less than 100% of the area median income. So the table gives you the sense of what that looks like. For a household of 3, that's $87,000 or less. And for a family or a household of 4, $96,600 or less. So compared to how these programs typically operate, these are very generous income brackets. So I encourage all families to take a look at this. You must be a resident of Montgomery County to apply. As I said, your children must be between 6 weeks of age and up to 13. Your children do have to be enrolled in a licensed child care center, a center licensed by the Department of Human Services, and the grant payments are made directly to the child care provider. The maximum payment amount is up to $40 per day and can be paid per child per day, not to exceed $2,480. So I urge families to take a look at that, and I hope that many of you will apply. And speaking of our kids, just want to remind you that we do have guidance for a safe and fun Halloween available for you at montcopa.org/Halloween guidance. That's all one word, montcopa.org/Halloween guidance. We want to make sure that kids and their families can have a safe and fun Halloween. So there's a lot of great ideas on this site for a little bit different ways to trick or treat. If you have any questions or you're planning a Halloween event, we would ask you to email montcohalloween@montcopa.org. That's montcohalloween@montcopa.org. Particularly if you're planning an event, and if you just run the details of that event by our Office of Public Health, they'll be happy to assist you and make sure that your event is as safe as possible. And then finally today, I just want to give a quick reminder about our Montco Office of Public Health walk-up flu clinics. So we have both walk-up and drive-through flu clinics this year. We launched our regional drive-through clinics last week in Upper Perkiomen, and there'll be a number of more clinics that will continue throughout October at different locations in the county. Starting tomorrow, Thursday, we'll have 6 walk-up flu clinics. They will be located in the same locations as our county COVID testing sites. So there is one in Pottstown, Green Lane, Willow Grove, Lansdale, Norristown, and Ardmore. So they'll be open every Thursday for walk-up flu shots. And then we'll have additional drive-through flu clinics on Fridays and Saturdays. Upcoming are ones in Cheltenham, Bluebell, and Oaks. The flu shots are offered at no cost to individuals age 6 months and older who live, work, or go to school in Montgomery County. We do require that you make an appointment. To make an appointment, visit montcopa.org/flu. That's montcopa.org/flu. Or you can call 610-278-5145. That's 610-278-5145. And with that, I'll turn over to Commissioner Ken Lawrence.
Good afternoon. I have 2 announcements today and then a brief election update. Last week, I announced that the Montgomery County Board of Commissioners had approved the purchase of 12,000 personal protective kits to be distributed to small businesses affected by the pandemic throughout Montgomery County. Today, I'm pleased to report that we've received the first shipment of 1,500 of these kits that were picked up by our local chambers of commerce and will be picked up or delivered to area small businesses. Businesses with 50 or fewer employees are eligible for 1 to 5 kits based on the total number of employees while supplies last. This initiative is a collaborative effort between the Montgomery County Commerce Department and the Office of Public Health in partnership with the newly formed Alliance of the Montgomery County Chambers of Commerce, and it will continue into November and while supplies last. We are committed to helping as many businesses, families, and industries as possible endure the financial hardships caused by the pandemic so they can continue to return to work safely and sustainably. The kits include face masks, face shields, digital thermometers, sanitizers, a thermometer, and other crucial COVID-19 mitigation and protection equipment, along with a Mask Up Montco window clings, floor stickers, and documents that provide COVID-19 information and guidance. CARES Act funding received by Montgomery County financed the kits. PPE is vital for businesses, their employees, and their customers and visitors. Providing these supplies to small businesses saves them time and money they'd otherwise use to procure PPE and allows them to do what they do best and keep their businesses going. So now I'd like to announce the members of the Alliance of Montgomery County Chambers of Commerce who you can contact. The Eastern Montgomery County Chamber of Commerce, the Hatfield Chamber of Commerce, the Indian Valley Chamber of Commerce, the Montgomery County Chamber of Commerce, the Norristown Chamber of Commerce, Perkiomen Valley Chamber of Commerce, Springford Chamber of Commerce, the Chamber of Commerce for Greater Montgomery County, the Tri-County Area Chamber of Commerce, and the Upper Perkiomen Valley Chamber of Commerce. And on behalf of our district attorney, I'd like to announce Drug Take Back Day. The event was canceled in April due to the severity of the pandemic. But this weekend, 44 police departments and agencies across Montgomery County are ready to collect all unwanted, unneeded, and expired medications as part of Drug Take Back Day. The Montgomery County District Attorney's Office and the Police Chiefs Association of Montgomery County are running this event, and it runs from 10 a.m. to 2 p.m. Saturday, October 24th. All locations are staffed by police officers. Take Back Day in Montgomery County, which coincides with the DEA's nationwide Take Back Day, is a chance for residents to clean out their medicine cabinets of unwanted, unused, and expired prescription and over-the-counter OTC medications and dispose of them easily in a safe, environmentally friendly way. Ridding medicine cabinets of these medications is an environmentally safe way and an important step for the safety of all households. Through this pandemic, overdose and overdose deaths have continued. Clearing out medicine cabinets and bathroom cupboards of unwanted and expired medicines is an essential step to keeping your home safe. The following are accepted during Drug Takeback Day and throughout the year at permanent med return boxes: prescription and over-the-counter tablets and capsules, inhalers, creams, ointments, nasal sprays, pet medicines, vaping products. Needles and intravenous injectable solutions are not accepted. And if you're dropping off medications, please wear a mask as you drive through. The participating sites for this upcoming Take Back Day are listed on the District Attorney's website at www.montcopa.org/DA. And finally, on the election, Montgomery County began mailing ballots on September 30th. People are receiving ballots and people are returning ballots. We will have 16 locations beginning this weekend where people can return their ballots. We have secure drop-off locations. We will have 4 satellite offices and then our main voter services office in Norristown. Ballots are going out every day. We anticipate that we will have 200,000 ballots out by this weekend, by the end of the weekend. So please be patient. Your ballot is coming. Make a plan. And there are several ways that you can return that ballot. We will also be finalizing all of our polling locations on Tuesday. There are only 11 polling locations that we still need to vote on as the Board of Elections. So for most Montgomery County voters, you can find your polling location on the Voter Services website. You can go to www.montcopa.org and click on the Voter 2020 tab. That will take you to the Voter Services website. And that concludes my report.
Thank you, Ken. All right, so with that, our next virtual briefing is Wednesday, October the 14th at 3 p.m., and we would be happy to take any questions.
This afternoon, we're joined by Jim Melwork from KYW. Jim?
Hi. You touched on some things, but as contact tracing goes, what are the main issues that you're seeing? You mentioned, sports teams, some quick hits. Is there anything that stands out specifically that you really want to address as far as where this is spreading?
Yeah, I think our number one challenge remains social gatherings. And we're seeing social gatherings of a variety of different sizes being places where people are getting exposed to COVID-19 and it is being transmitted. So I just want to really encourage people to be very, very careful if they choose to attend a social gathering. It's just human nature. So people have a drink or two, they have their masks off because they're drinking or eating. Sometimes there's music playing, so people are talking more loudly. It is an easy place for transmission to occur. So I just want to make sure people are very aware of that if they choose to go to a social gathering, and ask people to try to limit that as much as possible. What we've seen on our sports teams is consistent with what we've seen from the beginning, that there doesn't appear to be transmission on the field, but social gatherings before or after games, maybe locker rooms, some of that kind of activity does seem to be places where we're seeing lots of cases. We are not seeing a lot of spread, but what we're finding is that we have to end up quarantining entire teams because they're not being too careful in how they are following the social distance mitigation when they're, literally not on the field, when they're maybe on the sidelines or in the locker rooms or before and after these events or on buses. So, there's plans for all of these things, but they're not always being followed. And so when that happens, if 1 or 2 students test positive and we cannot accurately figure out who their close contacts are, then we end up, unfortunately, have to quarantine entire teams. So nobody wants to do that. Nobody wants to put their son or daughter in a room with the door shut for 14 days and bring them their meals and not let them leave. And so we just want to make sure people understand what quarantine means, and that the more that people can follow these guidelines, the better, because we want these things to be able to happen and believe they can happen fairly safely, but people have to follow these guidelines.
If with the election, obviously Philadelphia, a hot topic is poll watchers in elections offices. What's your guidance on both elections offices and then inside and outside with the drop boxes?
We're waiting for guidance from the Department of State on that issue, on both of those issues.
Okay, so at this point you have no say yet on whether
We're
anyone's allowed
waiting
in.
for the guidance from the
Gotcha.
Department of State.
As far as pre-canvassing goes, I was told yesterday or earlier this week, I saw blended together, that there are still discussions about a path forward in the state legislature. Is there a deadline or a date that the county would need that decision by to make it worthwhile?
We're 26 days now, I think. The sooner we would know, the better. We are not counting on that we will be able to pre-canvass. So, if that changes, I'm not even sure when the legislature is going back into session now with some of the things that have happened there. But yeah, 2 months ago would have been a great time to have known. So if it wasn't then tomorrow would be a great time to know.
Okay. Yeah, they're not back till the 19th, but I think there may be some kind of opportunity otherwise. If there is no pre-canvassing, what's your guess on when you could have meaningful results?
I don't like to guess because I don't know how many ballots we'll have. We've invested over $1 million in equipment with high-speed scanners and envelope extractors. And once we begin counting, we will count 24 hours until we are done.
I do believe that's it for me. Thank you.
Thank you. That concludes our questions for today.
All right. Thanks, everybody, and stay safe, and we'll see you next week. Bye, Sarah. Thank you.